President Biden and other global leaders gathered together virtually today to discuss the state of COVID, more than 2 years in, and he marked a solemn moment for Americans.
Today, we mark a tragic milestone here in the United States. 1 million COVID deaths, 1 million empty chairs around the family dinner table.
It's a milestone we once saw as unimaginable. And as Dr. Anthony Fauci said on Boston Public Radio this week, the White House is hoping to stop the continuing climb.
Hopefully, the enormity of that number would spur us on to do whatever we can to make sure that we don't have as bad a time in the coming months and years.
But the current reality is case numbers are again rising nationally. And here in Massachusetts, we've been seeing an increase in both cases and hospitalizations for weeks, leading some to reconsider those mitigation efforts we've dropped in recent months. So where are we now with the state of COVID and what's likely ahead? I'm joined by Dr. Sabrina Assoumou, assistant professor of medicine at Boston University School of Medicine and an infectious diseases attending physician at Boston Medical Center. Dr. Assoumou, thank you very much for joining us. A few weeks ago, you said we were at somewhat of a precarious moment. Students were coming back from breaks. And now they are in school. We're seeing cases rise. How do you interpret what's unfolding right now?
Thank you for having me on again. Unfortunately, we are back here again at a time when cases are rising. And, if you look at all the indices, if you look at the wastewater, you look at the number of cases, you look at the test positivity, we are at a point where there's a lot of COVID. If you look at Boston, the test positivity rate this week was 10%. And we knew that anything higher than 5% means that there's a lot of COVID. So unfortunately, there's a lot of cases right now in the community.
But what kind of faith are we supposed to place in testing? Fewer people are going to get testing, and when they test at home, numbers aren't necessarily being reported. I mean, I have family members, friends, not just in Massachusetts, but in neighboring states who are having, multiple breakthrough cases. So even anecdotally, you have this sense that there's a lot more going on than is being reported. So how much faith should we even put in what's being reported right now?
This is and the point that you're making about testing is actually really correct in the sense that we're missing a lot of cases that are not being reported because they're being done at home through rapid testing. So first of all, a lot of rapid testing is actually good news. I want people to test. I want them to know their status so that they'll isolate. But unfortunately, we're not recording those numbers. And so it's really hard for us to know what is going on with cases. But fortunately, we have other tools. We now have wastewater, which is actually a nice way to know what's going on in the community because it doesn't depend on people actually getting tested. And so we're at a point where we can use a lot of different tools. We could use wastewater. We could also use, what are hospitalizations doing? We could use deaths to kind of figure out where we are going right now.
So in the past 7 weeks, we've had cases rise among students, among teachers, and we kind of have a mixed picture of wearing masks. There are more than half a dozen municipalities that have said, okay, masks in school once again. So what do you think should be done at this point? Is it really just too confusing? Should we be doing this uniformly? Is this sort of patchwork approach the right way to do things?
This is a very good point. We're getting, different municipalities doing very different things. I think that, first of all, where are we in this pandemic? We're in a pandemic where we've actually learned a lot. We have a lot of tools. We actually have vaccines. There's a point, if you talked to me in November 2020, before we had vaccines, I would have told you early on that we weren't even sure that we were going to get something that was going to work. So we have a lot of tools. We have vaccines that we know work. We have testing, which you mentioned earlier. We know that high quality masking works. And we also know that we have these new outpatient treatments that also work. So the way I like to think about it is, when cases start rising, like right now, it is even more important to use a layered approach. We continue to recommend that people get vaccinated. We also recommend that people wear high quality masking in indoor settings. I know that a lot of people don't want to hear this, but when you're in a time when cases are rising, it is really key that we use all of the tools in our toolbox, including masking in indoor public settings.
So speaking of vaccinations, we have some numbers that we can put up about vaccinations and booster doses. In the United States, about 30% are fully vaccinated plus at least one booster dose. In Massachusetts, a little better, 44%. But are we at a point where the messaging about boosters needs to be much stronger? It feels like if immunity wanes after the boosters, we're just on the edge of yet another cliff if that message sort of disappears.
Yeah, no, this is a very important point. What we've learned is actually that booster, if you're eligible for that booster is not like an extra dose. I think that when we refer to, let's say, 2 doses of mRNA as being fully vaccinated, a lot of people get the sense that the booster is just extra and I may not need it. But what we've learned is that booster dose is actually very critical to providing a high level of protection, especially with Omicron, and especially when we're seeing waning immunity. So I agree with you that it's time for a reboot. We really need to let everyone know that boosting is going to be critical to getting us to the other side. So if you are eligible to get a booster, please get boosted.
And what should we be focused on now when it comes to our attitudes toward COVID? I mean, I think it's certainly understandable that people relax. You have nice weather coming. People feel like, okay, I know this virus. I know a lot about it now. If I get it, the cases seem to be milder, the hospitalizations maybe not quite as severe. What are we really risking in this picture? Is it really, we should really focus again on subvariants, on new variants, on long COVID? Should we still be focused on those things?
Yeah, no, there's still so much that we don't know. And it is true that what we're fortunate about is that the vaccines that have allowed us to turn something that used to be so deadly. I mean, if you talk to me in the spring of 2020, we had nothing and we didn't have vaccines. We didn't have appropriate treatment. So all the technology that we have has transformed something that was so deadly into something that's manageable. If someone has, a COVID infection after being, fully vaccinated or boosted, and they have mild symptoms, it's actually a win. And so I think that it is important to emphasize that our vaccines really work. And the way that we get out of this pandemic is still by continuing to vaccinate and boost as many people as possible. And the second message is, when cases start going up like they are right now, we need to emphasize the importance of using a layered approach. We cannot just rely on vaccines. We have to rely on masking, high quality masking in indoor public settings. We also need to rely on testing and using pretty much all the tools that we have so that we can get over this time period when there are a lot of cases so that we can try to relax some of those measures. I guess my other message is, pandemics end. This one will end too. But the way that it ends is actually, it would end when we decide that we're going to use all those tools and continue to use them so that we can get our cases really low so that we can get to the next normal.
Yeah, I think we have a battle right now, though, with fatigue as we talk about what's happening now, a surge that may happen again in the fall. Recently, there was a flurry of attention on Paxlovid as a treatment. A lot of people were saying this should have been really publicized much more. But now we're seeing stories about this treatment, after this treatment, seeing rebound cases. How should people view this treatment right now? Should they worry about that?
So as someone who's looked at the data, and actually as someone who was a clinician in the beginning when we had nothing, Paxlovid is a phenomenal medication. To have a drug that you can give to someone who's at high risk and decrease their chances of needing to be hospitalized by nearly 90%, that's phenomenal. So we need to use it as much as possible so that we can prevent people from needing to be hospitalized. What we're seeing is what looks right now like rare cases. If you look at the clinical trial, it seemed to be as low as 2% of people who seem to be getting recrudescence of symptoms. We don't really understand what's happening there. We're trying to understand it, but it is a very safe medication. And if you are eligible, please don't hesitate, take it. Because it really, in the clinical trials and what we're seeing in the field, it's really a drug that works very well.
Dr. Sabrina Assoumou, thank you for helping us put that all into perspective.
Thank you for having me on.